I'm Dr. Michael Benca. I'm a cardiologist with CHRISTUS Cardiology, currently working up in San Marcos. And today, preventive cardiology is on my heart. My wife and I moved out to this community after I retired from the Air Force about 7 years ago. And I remember to this day, one of her cousins lived in Kyle, 42 years old, had a 12-year-old child. He was put in a pull-up in Canyon Lake and had a heart attack and died. And so I always try and think, what would I have done differently with him? And for me, it's preventive cardiology. Anybody who knows me or is a patient of mine knows that they always get the coronary artery calcium score talk. And I order those pretty much universally on everyone. I feel it's my way to prevent badness, try and prevent things from happening, bad things happening to good people. And so I think for that reason, that test in particular, I think is very important, particularly in people with risk factors, but for most folks. I think there's a misunderstanding of what the nature of an acute heart attack is. I don't think most people know what that is. They assume that most people that have any heart-related issues are having a heart attack. It's actually not true. If you look at the nature of a heart attack, it's what we call an acute plaque rupture. It's a small amount of plaque in the heart arteries, say a 10-20% blockage, that suddenly ruptures, and then it becomes 100% blockage. And that's when folks get in big trouble. Heart muscle downstream of that blockage begins to die, and dying heart muscle is electrically unstable. And so those folks can go into abnormal heart rhythms and potentially leave us, very similar to my wife's cousin. And so I'd say routine health care, pay attention to your lipid panel, monitor your blood pressure, and of course eat a balanced diet, and try and do things in moderation, and exercise as well.